Recently, I've made lots of new links on social media, and I thought I would explain a bit more about what I do. All my treatments are tailor-made according to my clients' needs. So I combine different therapies along with my NST Bowen practice, and one of them is myofascial release. So what is myofascial release? First of all, what's fascia? Very simply put, it's a connective tissue that's woven around every muscle and bone and nerve and artery and vein in our bodies, as well as all of our internal organs, including the heart and the lungs and the brain and spinal cord. It is quite literally what holds us together. And it's a tissue where the musculoskeletal system, the circulatory system, and the nervous system all unite. It runs from the top of the head to the tip of the toes. When the fascia is in normal, healthy state, it's relaxed and a supple web. But when it's restricted, it can be rigid and less pliable, and thus creates pulls and tensions and pressure. Fascia has three layers. And the first one is superficial fascia, which lies directly below the skin. It stores fat and water and allows nerves to run through it and allows muscles to move the skin. The next layer is deep fascia, which surrounds and infuses the muscle, bone, nerves, and blood vessels to the cellular level. And then the deepest fascia, which sits within the dura of the cranial sacral system. So fascial restrictions can occur within any or all of these layers. And now a little bit about the therapy itself. Myofascial release is a safe and effective hands-on technique that involves applying gentle, sustained pressure on this connective tissue. And it's an effective treatment for rehabilitation of soft tissue and fascial aches, pains, tensions, and restrictions. Trauma, inflammatory responses, and surgical procedures can also create fascial restrictions. So here also myofascial release addresses restrictions of the fascia to help eliminate pain and restore motion. So when the fascial system is restricted, there is less lubrication for the soft tissue and myofascial structures, meaning they have adhered together, creating internal scarring and dysfunction, affecting the other surrounding structures. So fascia is a totally connected system and is the system that touches all others. Myofascial release uses a sense of touch so that each treatment is uniquely delivered with listening hands, which offers body-wide change to the tissue and the reorganization of the tissue, as well as a platform for emotional release and trauma resolve. And finally, the aim of myofascial therapy is to address any loss of flexibility or function following an injury or ongoing back, shoulder, hip, or virtually any pain in any area containing soft tissue. So that's my explanation of myofascial release.